Do you think about pregnancy while you're having sexual relations? Does the idea of having an unplanned family drive you insane? Then listen to this information we have for you today. The solution is out there, it's called birth control. Today we'll talk about its creation, laws in the USA, and what types are there that might work better for you.
Birth control, also known as a contraceptive and fertility control, is a method or device used to prevent pregnancy. Birth control has been used since ancient times, but effective and safe method of birth control only became available on the 20th century. Abstinence is one of the oldest methods falling in this category, and date all the way back to ancient times, likely has the longest history of any other method. Male condom has been used since 1000 before Christ, when Egyptians used a linen sheet to protect against disease. People start soaking the sheets in a sort of spermicide to protect against the syphilis, and later on the 1700s were being produced in London. In the 1800s, thanks to innovation by Goodyear ties, rubber started the rise as the material of choice for condoms. Throughout the 1900s, design and materials saw plenty more improvement, and couples continued to use them as the primary method of birth control. Birth control pills were approved in US in 1957, but were only prescribed for women with severe menstrual problems. In 1960, doctors were approved to prescribe the pills as a contraceptive for married women, but it was still illegal in 8 states. Pill use dropped by the 1970s due to the concern over side effects, but by the 1980s, safer and lower dose forms hit the market, and the pill reclaimed its popularity throne. Contraceptive implants were first conceived back in 1940, but it wasn't until 1980 that manufacturing actually began. Moreover, they weren't introduced to US until the early 1900s. The depot shot is an injection you get from a nurse every 3 months. Has been around since 1967, but FDA didn't approve it until 1922. Today it's approved for contraceptive use in over 90 countries. The patch and the ring have both been around for more than a decade. This method releases the same hormones that birth control pills, but throughout the skin or vaginal walls. Lastly, we have surgical tube ligation, which consists of getting your tubes tied. This method was first performed in Ohio in 1880.
Birth control is a term that describes any method used to prevent a woman from getting pregnant. Beginning in the 80s, laws in the United States prohibit birth control when temperance and anti-vax groups advocated allowing contraceptives and information about them. This group considered such information to be obscene, a belief that was popular enough that in 1873, Congress passed the Comstock Act allowing the dissemination of birth control devices or information through the mail. Most states followed suit by passing their own laws allowing the advertising, sale, and distribution of contraception. The following is an overview of access to birth control and law, including explanation of some of the most important court cases shaping these law policies. The turn of the century brought increasing attention to issues involving women's rights. Margaret Sanger, a strong advocate of birth control, opened the country's first proceeding in 1916 and was prosecuted for violating New York version of the Comstock Act. She served a 30-day sentence in a workhouse, but later established the National Committee for federal legislation for birth control. Sanger proposed a federal bill that outlined the health and death risks to women who underwent illegal abortion or who completed unwanted pregnancies. The bill sought to reverse the federal position prohibiting birth control, but under pressure, religion groups such as Catholic Church, Congress did not pass Sanger's bill. In 1966, the federal government, with the endorsement by U.S. President Lyndon B. Johnson, began public funding of contraception service for low-income families. President Richard Nixon in 1970 signed into law an act promoting research on population and family planning issues. Finally, in 1971, Congress repealed the key element of the Comstock Act. Some states keep birth control laws despite the repeal of the Federal Comstock Act. In 1972, the Supreme Court found unconstitutional Massachusetts law that only permit married couples to receive compensation. The court held that this law violated the equal protection right of single persons. In 1977, the court addressed a New York state law that permits only physicians to distribute contraceptives to minors under the age of 16, and only physicians or pharmacists to distribute contraceptives to adults. The court struck down this law as well. It became clear that the Supreme Court took as constitutional to protect the right of an individual, married or unmarried, to make personal decisions regarding whether to have children.
These are some of the risks and side effects of birth control pill. Birth control is a popular contraceptive, but many women are confused about its side effects and safety. Which side effects can it cause, and are they dangerous? Speaking of side effects, it is difficult for your OBGYN to determine which contraceptive pill will cause side effects in you. Many women do not experience any side effects while using the pill, but you may need to try a few different pills before you find the one which works best for you. Like all other medications, the pill can cause side effects. They do not affect all women, and they often improve after the first 3 months of taking the pill. It can take up to 3 months for your body to get used to the hormones. Possible side effects include changes in mood swings and depression, breast pain or tenderness, breast enlargement, fungal infections and cystitis, migraine or headache, feeling nauseous and vomiting, stomach problems and diarrhea, irregular bleeding, skin rash and acne, hair loss, changes in body weight, high or low blood pressure levels, and low libido. With every contraceptive pill having slightly different side effects, you should always read the patient leaflet of the medication you are taking. There are a range of other rare side effects that may occur in a small number of women. Speak to your doctor immediately if you experience the side effects for more than the first 3 months. Does it increase your risk of cancer? Contraceptive pills, which contains estrogen, have been found to cause a slight increase in your risk of breast cancer. Women who take the pill have also been found to have a slightly higher risk of cervical cancer. However, it is not entirely clear whether this is caused by the pill or different sexual behavior. Here are some facts and fictions about birth control pill. Fiction: you need to take regular breaks from the pill. Fact: incorrect. If you're happy with your pill and it isn't causing any side effects, you can continue taking it until the menopause. Fiction: the pill makes you gain weight. Fact: some women experience weight gain while taking the pill, but this side effect does not affect all women. Some pills, such as Yasmin and Celeste, are less likely to cause water retention and the associated weight gain. Fiction: the pill is bad for your health. Fact: while the pill can cause a slight increase in your risk of certain conditions, it also lowers your risk of other health problems, such as bowel cancer. It can also improve acne and reduce period gain. Affection, the hormones you take accumulate in your body. Fact, the hormones in the pill do not remain in your body for long. That's why you have to take it every day.
According to Planned Parenthood, the most effective and convenient methods are birth control implants and IUDs, with 99% effectiveness and low maintenance. They can be there for years. Also, birth control shots and the vaginal ring are 90% effective, which can be there for about 3 months, along with the birth control pill, which you have to take daily. All of these are hormonal contraceptives. We also have barrier contraceptives, which are the popular male condom, or a female condom, which is gaining popularity, or things like the diaphragm. We also have lifestyle contraceptives, things like abstinence, or the pull-out method, or sterilization, which makes it pretty effective because it lasts forever.
Birth control medication has various uses beyond preventing pregnancy. One of these uses is that it can make a woman's period less painful due to the fact that it prevents ovulation. When you don't ovulate, your uterus doesn't experience the painful contractions that can cause cramps during ovulation. Another use for birth control pills is that it can banish hormonal acne. Often, hormonal fluctuations are acne triggers. That's why acne is usually at its worst during adolescence. By minimizing these fluctuations, hormonal birth control can help to tame hormonal acne. Furthermore, birth control can lower your risk of some cancers. Women that have taken the pill for 5 years or longer that have had a 50% reduction in the risk of developing ovarian cancer. And that benefit continues even after stopping the pill. Birth control is also used to help alleviate menstrual migraines. A migraine is an intense headache that affects many women during their menstrual cycle due to the hormonal changes that are major triggers for migraines. Menstrual migraines are linked to a drop in estrogen and progesterone just before your period starts. Hormonal birth control medications that allow you to skip your periods, such as a continuous pill, can help to avoid this drop. Lastly, another use for birth control is that it can reduce your risk of anemia. Some women experience very heavy bleeding during their periods. This can increase the risk of anemia. People with anemia don't have enough red blood cells to carry oxygen around their body, which can cause weakness, fatigue, and hormonal birth control methods that allow you to skip your period can help to prevent period-related anemia.
Now that we know about the creation and loss of birth control, you can make an informed and safe decision about what form of contraceptive suits your lifestyle and needs. In this modern world where interpersonal relationships are a daily occurrence, we must be informed of our options to take command of life's big decisions.